What lessons can medicine learn by listening to those who live it every day? What happens when patients advocate not just for themselves, but for others like them? The stories that shape the future of healthcare are the stories we tell today. This is the Patient Perspectives Podcast. Hello and welcome back to the Patient Perspectives Podcast. My name is Lauren Scholler, and today I'm joined by Rachel Hayden. I am so excited to have you as a guest here. Rachel is someone I connected with on Instagram through her account SpoonFullofStrength, which we'll be talking about a little bit later. But Rachel has so much incredible insight of being a patient, and I am excited to hear from her. So, at the age of 47, Rachel is a proud Midwest girl from Indiana, navigating life with multiple chronic illnesses, including multiple sclerosis, type 1 diabetes, and ongoing undiagnosed conditions like muscle weakness affecting her lungs and colon, as well as chronic pain and stiffness. Diagnosed with type 1 diabetes in 1998 at the age of 21, an unusually late diagnosis, she endured a challenging journey as doctors initially treated her for type 2 diabetes. Her world shifted again in 2015 when she was diagnosed with MS, which led her to step away from a thriving career as a multi-unit district manager in 2016. The transition from working 60 plus hours a week to no longer being able to work was challenging to her self-image and mental health. Through therapy, Rachel rediscovered her self-worth and found new purpose. Together, Rachel and her husband of 25 years have raised three incredible sons, now 23, 21, and 18. And in 2024, she launched Spoonful of Strength, an Instagram community and Etsy shop offering chronic illness-themed merchandise. Shortly after, she teamed up with her sister-in-law to co-host the Spoonful of Strength podcast, a platform for sharing the diverse stories of people living with chronic illnesses and raising awareness about their experiences. Now heading into its third season, their podcast has produced 44 episodes highlighting resilience, community, and the power of storytelling. Thank you for being here, Rachel.
Thank you for having me. I'm really excited. I'm not used to being on this side of a podcast, so it's exciting.
Yeah, definitely. Can you start by sharing about yourself, background that might be important for listeners to know?
Yeah, I think you covered most of it, but yeah, medical wise, I've been dealing with illnesses for over 25 years. My type 1 diabetes was diagnosed at age 21, which is like really late for a type 1 diabetes diagnosis. So I was put on a type 2 diabetes regimen. And for some reason, my body adjusted to it for about a year. And then it was called like a honeymoon period. And then I got really sick, and they realized I was just a late bloomer in type 2 and been on insulin for over 25 years. And and yes, I've had MS since 2015. That was a challenging road for diagnosis. And I'm in the middle of a diagnosis for the muscle weakness issues that hopefully in the next couple of weeks we'll possibly get some answers. So I've been doing this for a little bit.
It sounds like it, and you've certainly faced a long road to these various diagnoses. Can you share what your early experiences with the healthcare system were like, and particularly what it was like to navigate the medical system for so many years before finally being diagnosed with MS?
Yeah, that was a rough one. 2009 was looking back, my first relapse with MS. I was getting ready for work and my toes felt numb, and I thought that was kind of odd. And within like 15, 20 minutes, my feet were numb and then my ankles, and it kept getting worse and worse. And I went into the doctors, and they sent me right to the hospital. And I was in the hospital for like 4 days. Luckily had stopped right below my knees and didn't progress any further. And from there, I was sent to my first neurologist appointment, and they did a brain MRI. They said, well, we see a couple lesions, but this is just your diabetes. It's just, you're just having these symptoms from your diabetes. And so it was many years of being followed up. And a year later, I had a relapse with the same exact symptoms. And even after that, it was just kind of a wait and see. It wasn't until 2015 that I was like, things are really progressing and getting worse. And my neurologist at the time said, well, let's go ahead and do every test that we have for MS. And I went through blood work and the MRIs and a spinal tap and evoked potentials and neuropsych testing. And from my understanding, it was just like a puzzle, and they just pieced everything together because there's not one test that will say, yes, you have MS or no, you don't. So it was just putting the puzzle pieces together. And after 6 years of symptoms, then I was finally diagnosed with MS in 2015. The muscle weakness part has been ongoing for I'm about 7 years after first symptoms. And I first had some problems with breathing, catching my breath, and things like that. And my pulmonologist did what's called a MEP test. And unlike your normal respiratory testing, it tests how strong your muscles are that support your lungs. And in 2018, my numbers came in about 30% of what they should be. And so that was the first thing that something was going on. The pulmonologist thought it was just MS. Neurologist is saying, oh, no, it has nothing to do with your MS. And many years of just kind of watching that. And then I started getting motility issues in the stomach and in the colon, and started getting muscle stiffness, muscle tenderness, difficulty swallowing. And then there was one symptom that kind of took me to take it a little bit more seriously. I would have these episodes that would last maybe 20 minutes, where it would come within 30 seconds. I went from being fine to having what felt like my whole torso being into like a Charlie horse. That's the only way I can explain it. Trouble breathing, nausea, you can't get in a comfortable position. And these episodes wouldn't happen very often, but it would happen often enough that after 4 or 5 of them got pretty concerning. And so my neurologist had said, this has nothing to do with MS. So I went back to my PCP and said, help me with this. They got me to another neurologist who ordered blood work and some genetic testing. And that's finally leading to a potential diagnosis of centronuclear myopathy. I had a variant in a mutation in my neuromuscular panel. And so I'm scheduled to get a biopsy done within the next couple of weeks to confirm that diagnosis. So 7 years going, and we're finally, I think, headed in the right direction.
Do you think the fact that you have multiple other diagnoses complicates getting new and accurate diagnoses? And, how have you navigated that? And what could medical professionals know or do for patients with multiple diagnoses that have additional symptoms that don't fit in their current diagnosis?
Yeah, I think it definitely adds a piece to the puzzle, especially even with the MS. They had kind of said, well, this is your diabetes, but my diabetes had been completely within limits, completely controlled. And so it was frustrating as a patient to go, well, how can this be because of my diabetes when it's been well controlled and I've done everything right? And normally complications from diabetes don't come until 20, 30 years of having, bad blood sugars. And so I didn't really fit that. And same with the weakness issues. It was doctors telling me it's your MS and the neurologist saying, no, it's not. And and I even had an EMG in 2022. It's a muscle test, and they found an issue with one of my muscles. And the doctor doing the EMG even said, you've got a muscle disease. And that EMG went back to the neurologist and they said, oh no, everything was normal. Everything's good. So a lot of times it's just difficult because the symptoms can kind of cross over a little bit. As far as how have I navigated this, I think at first I didn't navigate it real well. I had a lot of self-doubt as far as, well, is this just my MS? Am I just, are these symptoms real? I didn't advocate for myself until maybe a few years ago. I reached out to my PCP and I got a rheumatology uh, referral because of all the stiffness that I had. And I got that neurology referral when I was having a lot of the symptoms that my neurologist was saying wasn't a part of MS. And so I think that just navigating, trying to treat the symptoms, trying to find out the root of the symptoms that maybe don't fit into the categories, and then just seeing if somehow you can get to where you can line them all up and get a diagnosis that then you can treat.
Have you ever felt that those concerns and those symptoms were not being taken seriously by your medical professionals? And, how have you gone about feeling unheard in the healthcare system?
Um, well, with my experience, I feel like that they were heard. My concerns were heard, but I also felt like a lot of times they weren't taken seriously as far as actions to improve it. So if I said, hey, I'm having a lot of stiffness with my MS, well, that doesn't have anything to do with MS. Okay, but how can you help me? If it's not, lead me to somebody that can help me with it. I think sometimes doctors stay in their lane, especially when they're specialists, where if it's outside of their realm, then it's very difficult for them to try and help to find the answers that you need if it's not a normal symptom. I mean, I've been called a complicated case probably more times than I can count. But there's been times where it's been overly frustrating because I saw my neurologist last year and left that appointment crying because I said, I'm having more stiffness. I'm having this happen and this happen, and my ears are ringing and all of these things. And she literally said to me, Rachel, you have MS with a lot of damage. There are things I can't fix for you. Like, what are you expecting? And I walked out of that appointment just feeling very defeated because I'm like, so is this what my life is basically getting worse, and there's nothing I can do about it. And it was a very difficult situation to kind of understand that.
Sorry you had that experience, and I think unfortunately that is an all too common experience for patients where they go to see a specialist who, you feel like that specialist, you put a lot of hope into them because you think, this is the person who is supposed to know how to help me.
Mhm.
And I had a similar experience with a neuromuscular doctor. I think especially when we have multiple diagnoses or we have rare or complex conditions, you meet with doctors and they say that they don't have anything to offer you or that seemingly you're too complex to be seen by a certain doctor.
Mhm.
It is very discouraging. And when I had that kind of similar experience, it made me question whether my symptoms were as debilitating as it seemed like they were. Was I making it up in my head somehow? And it really leaves you feeling invalidated and discouraged. And, I find that because I have a rare disease, many doctors don't know, they have never heard of the condition, and that's okay. I don't expect every doctor to know what they're walking into. But something that has really changed, my care are the doctors who say, I don't know what exactly it is that you have, but I'm willing to try to figure it out. And
Yeah.
it sounds like, that would have been an important piece for some of your medical interactions as well.
Yeah.
To say like, I see that these symptoms that you're dealing with are really hard and debilitating, and we might not have an answer today, but we're gonna do everything we can to try to find that.
Yeah. And I think they don't understand that, especially with specialists, it takes forever to get in to see them. So you wait all these months and you're just hoping that this is the doctor that's going to figure it out. And you come in prepared and you have everything there. And, sometimes I would expect that, oh, they're going to know exactly what's going on. And then you leave going, oh, well, now it's just more testing and, more waiting. And you don't get that feeling of, okay, well, they really get what I'm going through.
Yeah, absolutely. In your experience, what does good patient-centered care look like? And can you share an example of a time when a provider truly listened and worked with you?
Yeah. I think that good overall patient care is like we're talking about looking at the whole picture. And if and also doctors talking to each other. I've had some doctors, very few doctors, who have actually said, I'm going to reach out to your neurologist and tell them what I'm seeing and see what they say and communicate. And that doesn't happen as much as I think it should, especially when you're dealing with multiple chronic issues. And I also feel like including other forms of healthcare, including mental health, including physical therapy, alternative therapy, and including all of that to treat you as a whole person, even though their specialty might be pulmonology or neurology, but it also needs to be encompassing because things will overlap and all of that. And I would say, as far as a doctor, I have had one doctor that I went to my PCP. I said I'm having all this stiffness, and my neurologist is saying it's not MS. Can you get me to a rheumatologist? And I met with a rheumatologist a couple of years ago in Indianapolis, and he is the only doctor that I found that has looked at the whole picture. A lot of things he looked for wasn't in his realm. And I appreciated that. And he's also kind of guided me and said, okay, I'm going to see you in 3 months. In 3 months, I want you to ask your neurologist to repeat the EMG. I would like for you to ask for this doctor to run this test. I would like for you to do this. And when I come see him, I bring all the results from everything. And he's the only one that is looking at things that aren't even in his wheelhouse, so to speak, just to help. And that's made the biggest difference in my care and my, getting to where I am now.
That's great. And I think it sounds like he's really including you as a partner in your care and valuing the way that you advocate for yourself to your other doctors.
Yeah.
It sounds like he holds a lot of trust in you, to like navigate those aspects of your care.
Yeah. And he's very honest with me, and he's told me, I don't know what this is yet. I have a short list of things that I'm thinking of, but I leave there knowing that he understands that this is a problem for me and that he's going to do what he can. And then if we get to a diagnosis and it's not within his rheumatology, then, at least I know that he's helped me get some answers.
Absolutely. Now, you had talked before about how, it was only within the last few years when you felt like you really started to advocate for yourself in healthcare
Mhm.
settings. I'd love to hear, how do you approach conversations with providers to ensure that your voice is heard in the shared decision-making process, and if you have any advice for healthcare professionals on how they can better include patients in treatment decisions.
Yeah, I think that the biggest thing that I've learned is to keep lots of notes. It's one thing to go in and say, my back's been really bothering me, but to go in and say, my back has been hurting for 3 months. I had, 3 weeks where it was really terrible and a couple weeks where it was not as bad, and keeping really detailed notes as far as your symptoms and really trying to communicate that. Um, I have a love-hate relationship with Google, but there are times where, especially like with my MS, with my neurologist, he said, well, stiffness has nothing to do with MS, and breathing does not have anything to do with MS, but the MS Society page states that it does. And so to be able to print that out, one of the things I didn't do very, very much is ask the whys. Well, why is this not? Because this is showing me that it is. Can you explain to me why it doesn't fit into MS? And I think that you have to just be honest and tell them, this is my body and I know something is not right. And yes, you have the medical degree, but I'm just telling you that this is not right. I've cried in many doctors' office of just frustration. And sometimes it helps, and sometimes it doesn't. But I think advice to like the healthcare professionals, one of the things that I appreciated when I was diagnosed with MS is that I was given a list of medications of like, these are things that I think that would be good to start on. Why don't you go home, look them over, and let us know what you're comfortable with? Because there were pills and there were injections and infusions, and kind of letting the patient have a little bit of control as far as that. I also think that, talking to the patient and getting to know them, there are some patients that really hate taking medicine and would rather do alternative therapy and vitamins and that route. And there's people that believe that the medicine is the best option. I'm kind of in the middle where I think, there whatever's right for me. But I think that could be something that could be incorporated a little bit more, and just knowing that each person is different and trying to figure out the best therapy and the best way to go forward with their disease based on that person.
Something that you said that really resonated with me was going in with information from online. I firmly believe that educated patients feel more empowered and they make better decisions as a result. And for patients nowadays to have access to information online, I think it's such a gift to be able to go home, and it's a lot to process during medical appointments, all of the information that they give. So whether you can either prepare ahead of time with information that you want to bring to your doctor's appointments, or you can hear what the doctor wants to say, take some time to digest it, and find reputable resources online to further your knowledge about it so that you can make better decisions. I think that's excellent. And for doctors to value patients who do that rather than thinking that patients are doing it to question their expertise,
Yeah.
having doctors and medical professionals who are grateful for you, like to bring in more information and to learn with each other. I think that's really what it's about, is creating a partnership where you can each learn from each other.
Yeah. Yeah, I think that, and also, another tip is to bring a supportive person with you, because I have cognitive impairments because of MS. So sometimes I don't understand what he's trying to say, or I don't remember by the time I leave the appointment. And so making a lot of notes and bringing somebody with you. A lot of times we'll leave the doctor and I'll ask my husband, I'll say, what was he saying about this? What was that about? And having that other person to absorb, the news that you receive. So
That is really important, having that
yeah,
support. And also, I think more health systems are making the patient portals accessible and
Mhm.
like medical record information accessible to patients. So I think that's always a great resource to be able to go online after the appointment and see what the clinic note says, because
Yeah.
that kind of gives you the doctor's interpretation of how
Hmm.
how the appointment went. And I think it's important to identify sometimes, I might leave an appointment thinking it went a certain way, and then I read the way that my doctors wrote about it, and I think, wow, maybe there's a little bit of a disconnect.
Yeah.
And that's important because that's part of your medical record, and other medical professionals can see it. And so making sure that you have that open communication if there ever are disconnects,
Yeah.
um, to ensure that you're all on the same page.
I think the online charts are really nice to have, and one of the things that I've done, because there have been instances where there's been like poor communication between the assistants, and so I rarely call my doctors anymore. I always run it through the messages, and that way you kind of have um, everything, all the discussion is back and forth, and you've got it time stamped. And because there's been times before when I've asked for a refill, and it's a struggle to get it done, and I had an experience with horrible communication, and I was able to go to my doctor and say, listen, this took 3 weeks to get done. This took 2 weeks, and it's good, especially when you have some cognitive issues, to kind of have that conversation in writing.
Absolutely.
Yeah.
What's one thing that you would love to see in healthcare, one change that you would like to see in healthcare that would make a real difference for patients, especially with chronic illnesses?
Hmm.
And is there something that you wish providers truly understood about the patient perspective?
Yeah. I think a change might be, I think that genetic testing, for me, genetic testing wasn't done for this muscular issue until 7 years down the road. And I feel like with all of the symptoms I was having, and I was having tests that were coming back normal, and that piece is something maybe that should be done sooner. It might cut down on a lot of time. And obviously, alternative therapy, like I've talked about. But, when I was diagnosed with MS, this was, of course, 2009 to 2015. There was a criteria for diagnosing MS, and I think they've changed it. But at that time, you couldn't be diagnosed with MS until you had at least two relapses that were a year apart. You had to have a certain number of lesions. And that was frustrating for me because it was like, okay, you're waiting for it to get worse before you can actually acknowledge that this is something that could be treated. And so, um, I know with a lot of chronic illnesses, things just aren't black and white. Um, so I think the genetic testing portion of that, and also kind of understanding that, there's a big thing in the chronic illness community of, my labs are good. I've seen t-shirts that say your labs look fine, and I hear that so much. And it is true that just because your labs are fine does not mean that there's not something going on. So, something that I wish providers understood a little bit more is that a lot of times we're years into this journey, we're scared, we're confused. We're not trying to get a diagnosis because we want the diagnosis. Just being gentle with us and understanding that this maybe it's been a long journey for us, and we're just looking to find out what our pain, what's causing that. And I think one of the things I'm really passionate about is just the mental aspect of it, especially when you're years into not knowing why your body's doing what it's doing, and just understanding that part of it. Um, Sometimes, it can be, well, your labs are fine, so everything's fine. So that's it. And the mental part of that whole diagnostic process is almost as frustrating as going through the physical testing.
That kind of touches on seeing a patient as a whole person
Mhm.
because there are absolutely mental, emotional, social implications to being a patient with chronic illnesses.
Yeah.
And or to being a patient with undiagnosed conditions and it is a very taxing process. So I think for doctors to understand that and to ask about it during appointments to make
Mhm.
sure that you're coping well. That's always been something that I've appreciated from most of my doctors is that they make sure to check in to ensure that I am coping well with what I'm going through.
Yeah, that's important.
Yeah. Now, I wanted to kind of pivot to your Instagram and podcast. What led you to create Spoonful of Strength, and how has connecting with other patients shaped your view on healthcare and advocacy?
Yeah. I think I went into 2024. I personally, I don't know a lot of people with chronic illness. My family doesn't have any chronic illness, and it can be very isolating, and it um, can make you feel alone when you're dealing with pain every single day and nobody gets it. And so I was like, well, what if I just had an Instagram page where I can invite anybody that has a chronic illness. It doesn't have to be an MS page. It doesn't have to be a type 1 diabetes page. I say on the podcast a lot of it's like the umbrella of chronic illness. We all share the same thing of chronic pain, chronic fatigue, and all the diagnostic things and the mental part that go with it. So what if I had a community where I could just learn from people and meet people and inspire people, and so that's where Spoonful of Strength was kind of thought about. And if you're not familiar with the spoon theory from chronic illness, it's something. If you aren't familiar with it, definitely Google it because it's very interesting. But that's where Spoonful came. Is that the spoon theory talks about how people with chronic illness deal with their fatigue and how we're given very limited spoons or energy. And so I knew I wanted Spoon to be a part of that. And so Spoonful has two L's because a spoonful with one L is a very small amount. But we have limited spoons, but those spoons are so full of strength. We are strong, and we are dealt with these chronic illnesses, but we attack it with such strength. So that was the reason behind that. And so I started the Instagram page, and then I opened up an Etsy shop because I didn't like the types of t-shirts I would find out there for MS. They were all very bright and very just loud, and I wanted simple designs that would incorporate any chronic illness. There's some funny things that you can find in my shop, and then there's some inspiring items. And shortly after, within weeks of starting up the Spoonful Instagram page, I thought, well, what about a podcast? Because just talking about, at first it was just about talking about chronic illness, and my sister-in-law is a stage 4 cancer survivor and has fibromyalgia and chronic back issues. And so I've known her for over 25 years. So I said, you want to try this? And we started out just talking about chronic illness, and then we found somebody that had an interesting story, and we said, why don't you come on and talk about your illness and talk about your journey of discovering that you have this illness. And it's since gotten to the point where our episodes are half Tina and I discussing a topic of chronic illness, and then every episode we invite somebody in to talk about their chronic illness and to raise awareness for their illness. And by doing that, what we found is that this whole Spoonful brand has given me more than I have ever expected. And just talking to people that have gone through such heartache and are living with these chronic illnesses has fed more of my soul of just feeling like, number one, I'm not alone in this, but I get inspired by them, and I love hearing their stories and how they have turned some of the rottenest, turned just the most devastating news, and these people are just inspiring, and the way that they've turned that into living to be able to find a cure, to be able to get that illness out there. And a lot of the people that we've had on, advocacy is the biggest one that we've seen, is just people having to advocate for their health and advocating for getting people to take that illness seriously. And um, it's grown quite a bit. We were doing twice a week, and with chronic illness we both said, whoa, that's way too much. So we've done once a week, and we already have next season, we already have spoonies coming out of the woodwork, and we've got a list of people that just want to come on and share their story. So it's been an amazing ride, and I'm excited to see what 2025 will bring us.
That's incredible. There is so much power in community. That's one of the greatest things that I have gained through sharing my story on Instagram is finding the community.
Mhm.
When you realize you're not alone, or when you realize that there are others out there who you can be a resource to,
Mhm.
um, that it just really like changes the whole it changes the way that you can go about life because as you mentioned earlier, it can feel very isolating when you're in the midst of these very difficult experiences. But when you look online and you see that you're not alone and you have someone who you can message after a difficult appointment to kind of talk through and process and to see that they have been through something similar,
Mhm.
um, is really cool. And I think it's an important like piece of the community and an important piece of support. It's kind of like peer support from others who really understand it. So
Yeah.
that's wonderful. And like you said, there is so much strength in the community. It is inspiring, and for you to take your experiences and then create a platform where you can connect with others and to really be a resource for those who are going through very challenging things, is really admirable, and that a lot of people find support and strength in your story as well.
No, I appreciate that. I'm not one that likes to put my face out there. I get a little bit nervous about that. And so a lot of, my post and things, I'll talk a little bit about myself, a little bit more maybe on the podcast, um, but I enjoy the spoonies that we've had on over the last couple seasons. I am invested in their stories, and I will reach out to them and say, hey, how are things going? Or I'll see a story of maybe some bad news or another diagnosis. And so it's been so good for me to know that there's people out there that are in the same boat as me. And same thing, if I'm having a rough day, I'll throw it up on Instagram, and it's amazing how people can lift you up and just understand what you're going through as well.
It really is, and it makes me grateful to, be living during this time where there is such a social media presence. And
Yeah.
I think about the some of the things that I've been through, and especially having a rare disease, I only know others with my condition through, a pretty small support group on Facebook.
Yeah.
And so if it were not for the availability of social media and the access to that, I do think it would be pretty lonely at times.
Yeah.
So it's really neat to see those growing and to, continue just showing up for other individuals with chronic illnesses.
Yeah. Yeah.
So that brings us to the final segment of the show. This has been a really awesome conversation so far, but this final segment, I am calling it Memorable Moments, and this is a time to share a recent reflection, a piece of advice, or a meaningful anecdote from our experiences as a patient, something that has stuck with us. And this could be a lesson for fellow patients, or even something that providers can take away to improve care. And I'd just like for it to be a way to end the episode with a thought that resonates with listeners long afterwards. So I'm happy to go first while if you want to think about yours.
Okay.
So mine, th this happened a few weeks ago. I was going to my PCP's office and I was seeing a different doctor, not my regular PCP, but it really made me think about how significant it is, like the way that a doctor sits and presents themselves to a patient. Because the way that the clinic room was set up, there was a computer in the corner, and then the chair that I was sitting in was directly behind the computer. And so the doctor, in order to write her notes while she was talking to me, she was sitting with her back fully towards me.
Mm-hmm.
And I just felt like I was talking, to nothing. And it felt like a really odd dynamic to be comfortable enough to open up and share everything that's going on while she's like not even able to make eye contact with me.
Yeah.
I understood that she had to write her notes, to make sure that it was accurate in the moment, and that's fine. I'm all for that. But it just really struck me that that whoever designed that clinic room, I don't think they really had the patient in mind or like creating a really inclusive environment in mind because it kind of felt like I was just talking to a brick wall as she was typing and she's going uh-huh, and I'm just talking to someone's back. And that was the first time I've ever had that happen where there wasn't really an opportunity for her to turn around and to talk face to face. So, that was just really interesting. And, even the environment of care can contribute to its inclusivity and contribute to the way that patients might feel comfortable talking with a medical professional.
Mm-hmm. Yeah. Yeah, that is interesting. I've got a doctor's office the same way, but the nurse practitioner got a lap desk and put their laptop on the lap desk and she rolls right up to me and that does make a difference.
Yeah, that's great.
Yeah, yeah. So, um, well, I think my reflection, I think one of the things that I'm really passionate about, and I've mentioned it before, is the mental health part of it. A lot, if you scroll our Instagram page, you'll see some quotes come through and different inspiring things. But one of the things I haven't really shared today is being passionate about mental health because when I was diagnosed with MS, about a year later, I was working a job that was 60 hours a week, traveling every day. And all the while, I'm having all these episodes and symptoms, and I had to quit that job. And from there, I went into a pretty severe depression. Um, for a few years, I really struggled with my mental health. My thoughts at the time were I'm broken. I am not working. I'm not financially helping the family. I'm not a good mom. I'm not a good this. I'm not a good that. What did I've said it multiple times to my husband. This is not what you signed up for. You married me. This is not what you signed up for. And a lot of that feeling of being broken. And I was lucky enough to find a therapist that has um, helped me kind of rebuild that mindset. And I think that's something with chronic illness that many people go through, of either feeling like you're in a body that you don't recognize, or feeling having issues with self-worth because you're not the same person that you were 5 years ago and you can't do the things that you could. And I'm dealing with that a lot. I've had my mobility has gone down a lot in the last year, and I'm still dealing with that fact of not being able to do the things that I used to be able to do, and feeling like at 47 I should be able to jump off the couch and go for a run. And right now it takes me 10 seconds to get up off the couch, and I'm using a walker and different things like that. So one of the quotes that I've held close to me over the last couple of years, it says that one small crack doesn't mean that you're broken. It just means that you were put to the test and that you didn't fall apart. And I carry that with me because I think that sometimes we are put through so much mentally and physically that it's easy to feel broken. But when you really look at it and say, but I didn't break, and I'm here today, and I've gone through all of this, and I'm still here, and trying to look at it from that perspective of I've made it all these years, that I can continue on this because I've made it this far. So,
That's really powerful, and it brings up an important point, which is the mental and emotional aspect of going through these things. Anyone in the chronic illness community should be proud of themselves for making it to the end of the day because that takes so much strength and energy. And I think that's something that's not celebrated enough is,
yeah.
how difficult these days can really be.
Mhm.
Even getting out of bed and going to a doctor's appointment, there were times when I was in the midst of like, one of my most challenging medical experiences, and when a commute alone exacerbates your symptoms, there's a significant mental weight of anticipating the fact that I'm going to feel a lot worse when I get back from this medical appointment.
Yeah.
And so, I advocate for patients should never feel ashamed for seeking mental health support and therapy. And I
Yeah.
think therapy is such a valuable tool that really anyone could benefit from, even if you're not going through challenging diagnoses just in life to have that extra mental support because life is hard as it is.
Yeah.
Um, so thank you for bringing that up, and certainly it is a really important topic that medical professionals should be asking about.
Yeah.
And I also really appreciate it when friends or people in the community ask how that aspect of my life is going, you
Yeah.
know?
Yeah. Definitely.
Yeah, well, that's really, really great conversation. I so appreciate you coming on to the podcast today. Rachel, where can listeners find you, and is there anything you're working on now that you want to promote?
Yeah. On Instagram, we're at Spoonful. Again, Spoonful with two L's, Spoonful of Strength. Our Etsy shop is spoonfulofstrength.etsy.com. And then our podcast is available right now. We just started our third season, and new episodes come out every Tuesday. And we're on Spotify, Amazon, Apple, iHeart, and we have a YouTube channel as well. And yeah, right now we're in the midst of our season 3 and interviewing people every week and talking about important things. And so that's Spoonful of Strength all the way around. That's where you can find us, and we invite you to come in and join our community.
Awesome. Thank you again. I'll make sure all of that information is linked with the episode on Spotify, YouTube, and Instagram. Thank you.
Anytime.